Now, we have seen many a times we get biceps tendonitis, and a lot of injuries in the biceps strains are very common. So, for the biceps, you run along the length of the muscle. You scan it. As I scan it, I can assess it over here. So I can feel the adhesions here. So what I'll do is getting the adhesions over here. So let's resolve this. I'll just comb it. So I'm being too superficial. And as I reduce the angle, I can go deeper and deeper as the thumb rule says. So how do you feel, Varun? Okay, so we can see over here the swelling has reduced, the adhesion is better, the tissues are better, more pliable. Now we'll just pin it over there in the muscle belly and do the action. You need to take care that your IASTM should not be very vigorous, it should be very soft and it should be tolerable according to the patient's tolerance level.